Hey guys, thank you for joining us today. I'll be working on Tessa. We're going to be doing a full back massage and we're going to get right into it. So I'm actually going to start without any oil, and I'm going to start with a really simple decompression move to kind of create space in the vertebrae and relax the spine. So just one hand on the upper back and one hand on just above the coccyx. So I'm just gonna pull my hands away from each other. And of course, if someone has, low back spasm or a lot of pain, I wouldn't do this. So this is for someone, just your everyday kind of client or friend, whoever you're working on. Yeah, and just a nice little stretch for the low spine. And it can also feel really nice if you put one hand around the scapula, so around the shoulder blade, and you can actually just, you don't want to make your client feel uncomfortable with an open hand, so you can just kind of soft fist and pull your hands in the opposite direction. This is really nice stretch for the low back especially. And you can hold for a good 10 seconds, and opposite side. And again, you just want to work with a closed hand so it's not awkward. So you are just moving your hands away from each other. It's a great way to start. And I'm finally ready for my oil. So the way I work, I like to use as little oil as possible, but I like to be able to glide, smoothly across the area that I'm working. So I use like a moderate amount of oil. And there's all kinds of ways that you can apply the oil. It can feel really nice to just alternate hands, and just try not to be choppy. So just work as slowly as you need to just find kind of a rhythm in what you're doing. And I'm also just kind of scanning Tessa's back with my hands, and also visually I can see that, that mid-thoracic looks pretty tight. So just kind of using this warm-up as an opportunity to get more aware of what's going on and what kind of work she might need. And I can't emphasize enough just really working with your whole body instead of trying to do everything with your hands. You're not going to last very long as a massage therapist if you don't practice proper body mechanics. And just making sure that I get plenty of oil on all the spaces that I need to work, so that I can kind of keep my hands on Tessa. Can feel really comforting to just not lose contact. And I'm just gonna start working my way down the spine. So I'm gonna use the heel of my hands, and I'm just gonna work my way down. And I'm not really concerned about how deep I'm going right now. I'm just, again, scanning the muscles and warming the soft tissue up on the way down and on the way up. I'm gonna start using a little bit more pressure. So I'm just gonna come in with that soft fist, and I'm gonna run my Hands along the spine, working those erector muscles, and I'm kind of already picking up on Taya's right mid-thoracic is pretty tight, so just making sure that I designate plenty of time to the areas that need it most. I think the worst thing that you can do when you're offering body work to someone is to be mechanical about it and treat every client the same, because every body is just so different. I'm just sharing a few techniques that I really like for full back massage. So I'm going to go ahead and focus on lengthening the muscles today. So I'm just going to go ahead and work my way along that erector muscle, and I'm going to move my right hand in the opposite direction. So just really encouraging the muscles to let go and lengthen. And you get a lot of bang for your buck with this move. You can really target a lot of different areas. And it does require a little bit more concentration, but definitely worth it. And I really like to finish the work on the lower half into the hip. Hip work is one of the most powerful things you can do to relieve pressure on the back, especially the low back. And I talk a lot about transition, so I don't just, plop over to the opposite side. I really try to keep everything cohesive and connected. So just doing the same exact thing on this opposite side, and I definitely know that I need to spend a lot of time in Taya's mid-thoracic. Over here it feels a lot more contracted for some reason than this side. And just working my way into the hip a little bit. And so I already have a really good sense of kind of where I need to be focusing more of my attention. The mid-thoracic can be a little bit tricky because it can be pretty ticklish on a lot of people. So there's different ways that you can kind of work with someone that's ticklish. So I'm just gonna go in with my right elbow, and I'm gonna start working my way down. So this is a really safe way to work the erector spine, because you're protecting the spinal column as you go down. You have a lot of control. So the rhomboid's a little bit, but my main focus here is on that erector muscle. So you have a lot of control in this position. It's just a really nice way to work, especially if you're unfamiliar with working on the mid-back. And as much as possible, I'm just trying to keep my own spine long, and I'm conscious of working from my core. All right, so what I'm going to show you is I typically work the erector muscle with the opposite arm. So I just really love this because you have so much surface area that it tends to be less ticklish, and you also have a lot of control because there's so much surface area that you're working with. It can be a little intimidating when you're starting out doing massage to work on these muscles along the spine. But there's really no need to, feel discomfort. There's a lot of great techniques to work these muscles effectively. And sometimes what I'll do is, if the muscle's responding well and my client's not ticklish, then I might start using less surface area to go a little bit deeper. So one way that you can do that is you're just going to start to angle your forearm a little bit, but you want to make sure that you feel nice and secure. So if you start to feel unstable, then go ahead and just continue to work with more of your forearm than your elbow. I feel pretty good and the muscle is responding really nicely. So I'm just gonna start kind of angling my elbow in a little bit more. And it's nice if you can go slow. Sometimes if I'm working on someone who has anxiety, it can feel really nice if you just put the full weight of your forearm down and move really slow. You know, using this broader surface area is really nice if you want to feel like you have more control. And I'm really focusing on the erector. So a really nice way that you can do some trigger point without losing your control is go ahead and just, you know what's going on, you have that sensitivity, and then you can actually protect the spine with your opposite hand. So I'm going to go ahead and guard the spine with this hand, and I can apply as much pressure as I want with this opposite elbow. So I'm going to go ahead and do a little bit of trigger point in here. And I'm going to just start working my way down. And if it feels kind of wobbly, then you're definitely on the right spot. So I'm just trying to encourage that deeper tissue to let go a little bit more. And I'm probably not going to do this trigger point work on the opposite side because I didn't really notice the same kind of tightness on the left. And you can even use this, you don't have to do trigger point. You can actually just work your elbow up if you like. And you don't have to worry because the spine's nice and protected with your opposite hand. And you can work your way all the way up into the rhomboids if you like. Okay, so I am ready for this opposite side. So I'm going to go ahead and just go in a way where I feel like I have less room for air, I guess. So just working my way down. This can be, I just find that it's a little bit tricky on people that get ticklish. This can be kind of, maybe not an ideal technique. Just working my way down. And I'm going to go ahead and just go right into this technique that I usually use. I always start this kind of work using my whole forearm. And this is a really nice way to get a little bit deeper, but it's not super uncomfortable because you're using so much surface area. So this left side is actually a little bit tighter than I was expecting, so just spending a little bit more time here. And the more time that you spend on one area, the more sensitive you're gonna feel. You're gonna just be more aware of what is going on. And it took me a long time to kind of get the sensitivity that I needed in my elbow. But it'll come if you practice. So what I'm gonna do is I'm gonna go ahead and so I'm just gonna protect Tessa's spine with my left hand. This isn't absolutely necessary, but it's just a really nice way to know that you can apply as much pressure as you need to while protecting the spine. And I'm going to start doing a little bit of trigger point in here. And then release. And you can also just use that safeguard of the opposite hand, and you can just run your elbow all the way up towards the rhomboids, into the shoulder if you want. definitely don't want to forget about the upper traps today, so I'm going to go ahead and if I kind of am running short on time in a session, I'll kind of do a few different things. So I really like to start by, this is really just such a nice way to get more blood flowing into the upper traps and the levator scap. So you just need to be careful that you're not pinching the skin. You're really staying on the muscle belly. So I'm just compressing that muscle tissue, encouraging increased circulation. This is just great for, if there's congestion, just clearing some of that out. And again, just don't expect for things to feel exactly the same from right to left. I'm going to start just going in with my thumbs. And I'm going to do kind of broader circles. And I'm just kind of stopping right along that spinal column. So just kind of stimulating that connective tissue along the spine, as well as stretching that muscle fiber. I'm going to go ahead and go in with quite a bit of pressure. I'm just going to start working my way down into the levator, right and left. And I'm really careful about how much I use my thumbs in a session. You really need to protect your thumbs and just use your elbow as much as you possibly can. And I'm going to go ahead and end this session. I'm just going to kind of massage along the occipital ridge. It's a really nice way to kind of relieve pressure on the shoulders and the neck. And I just like to remind my clients that it's all connected. So, something that's going on with your shoulders might be a misalignment in the neck, or it's not always what it seems. And that's it for today, guys.
If you enjoy these videos, please join us at PsycheTruthPatrons.com for dozens of exclusive videos and premium programs. We have over 1,000 videos you won't find on YouTube, such as modeling and fashion hauls, exclusive massage videos, ASMR, behind the scenes, bloopers, and much more. It's a great way to help us keep the cameras rolling so we can continue making the content you love. Patrons will get 2 to 3 new exclusive videos each week, so I hope you'll consider joining our Patreon family today. Just visit PsycheTruthPatrons.com.